Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So today under course THH 1003 Anatomy and Physiology for Technologist, I, Nur SOFEA BINTI, metric number 12111128, are going to present on cardiovascular system. So first of all, we're going to talk about the blood because it is very important in our cardiovascular system. So we're going to talk about the properties and functions of our blood. Let's get to know about blood. Blood is a liquid connective tissue that consists of cells surrounded by a liquid extracellular matrix, and it contains of two components, which is blood plasma, 55%, and the second one is foam elements, which is 45%. So blood plasma, it consists of proteins such as albumins, globulins, fibrinogens, and others. And it also consists of water and other solutes such as electrolytes, nutrients, gases, regulatory substances, and waste products. For the foam elements, it consists of platelets, red blood cells, and white blood cells. As we know, white blood cells has 5 different types, which is neutrophils, lymphocyte, monocyte, eosinophils, and basophils. So as we know, neutrophils has a largest amount in our body, followed by lymphocyte, monocyte, eosinophil, and the last one is basophil. We're also going to talk about the 3 general functions. The first one is transportation. As we know, our blood transport oxygen from the lungs to the cells of our body and carbon dioxide from the body to the lungs. And it also carries nutrients, hormones, heat, and waste products. The second function is regulation. It is to maintain our homeostasis and regulate pH, and also to adjust body temperature. And the third function is for protection. It will clothing to prevent excessive loss, especially if we're having an accident. And white blood cell also helps from disease. Just now we'll talk about the general functions of blood. So here we're going to talk about the major functions of the cardiovascular system. So there are 4 major functions that we're going to talk about in this system. The first one is transportation, second one is protection, the third one is thermoregulation, and the last one is fluid balance. So we're going to talk in a detailed way. So we're going to the first one. The veins, arteries, and capillaries that carry the blood from the major artery to the small capillaries. The heart works with the lungs to take oxygen to your body and exhale the carbon dioxide that has built up in the cells. The blood also carries nutrients, hormones, waste products, and sometimes medication through the body. And for the protection, we're going to focus on 3 things, which is red blood cells, white blood cells, and platelets. For the red blood cells, it carries oxygen through the body. As it travels to the lungs to provide oxygen, then binds with hemoglobin. It also drops the oxygen where it is needed and picking up the carbon dioxide. And for the white blood cells, it will find infection and attack in our body. It also helps us by creating the antibody for our immune system to fight off the infection if it happens again. And the third one is platelets. It will closing up the wound by creating a thick barrier that blocks the loss of blood. For the thermoregulation, our sweat glands, the thermoreceptor in the body will go on alert when the temperature rises. The response is sweat secreted onto the surface of the skin in an attempt to cool things down. And for the muscle around the arterioles, it will relax, so it will allow more blood to pump through. So this brings a rush of blood to the skin, allowing the body to cool off. The third one is skeletal muscle. So this muscle contraction to produce heat which can then help raise our body temperature. And the fourth one is the endocrine gland. It will create a plenty of thyroxine, adrenaline, and noradrenaline. It also will trigger an increase in the metabolic rate, which then warms the body. And the last one for the food balance. Every cell gets the proper amounts of electrolytes, nutrients, and gases. So our body then triggers hormones that target certain functions, such as increasing urine output or kidney function. Okay, our blood vessel might also constrict or expand, thus allowing more or less of the body's fluid to be lost through sweat. Okay, just now we'll just talk about the functions of our cardiovascular system. So now we're going to talk about our heart. Okay, as you know, the heart and circulatory system make up our cardiovascular system. So let's talk a bit about the heart. It is roughly the size of a fist and sits in the middle of your chest and slightly to the left. Its function is to pumping blood around your body as your heart beats, and it also sends oxygen and nutrients to all the parts of your body and carries away unwanted carbon dioxide and waste products. And the blood is carried from your heart to the rest of your body through a complex network of arteries, arterioles, and capillaries. So the blood is returned to your heart through the veins and vein. So it has a different way uh, from the heart to the body and from the body to the heart. Okay, as we know, the heart is made up of three layers of tissue, which is epicardium, myocardium, and endocardium. So basically, the heart it has four chambers, which is two superior receiving chambers, which is left and right atrium. It's located upper at our heart, and the other two is inferior pumping chambers, which is left and right ventricle. So the various chambers of the heart are separated by partitions, each of which is called a septum. So we're going to look in a easy way in the next slide. Okay, so this is an easy way for us to look at our heart. As I already said before, our heart has four chambers, which is right atrium, right ventricle, left atrium, and left ventricle. So the partition that separate our chamber between the atrium is intra-atrial septum here, and separate between the ventricle is intraventricle septum here. Here. Okay, so we're going to focus on the right side first. Okay. Okay, so right now we are going to talk about the right side of the heart. As we can see here, we have two main chamber, which is right atrium and also right ventricle. Okay, so um, all all blood enters the right side of the heart through the two veins, which is the superior vena cava and also the inferior vena cava. Okay, basically superior vena cava will collect blood from the upper side, from the upper half of the body, while the inferior vena cava will collect blood from the lower half of the body. So the blood will leave the superior vena cava and also inferior vena cava and enters the right atrium here. So when the right atrium contracts, the blood goes through the tricuspid wave and into the right ventricle down here. The function of tricuspid wave is to allow the blood to flow into one direction only. So when the right ventricle receives the blood, it will pump the oxygen poor blood to the lungs through the pulmonary wave and to the pulmonary artery and into the lungs where it picks up the oxygen. because the blood that we receive at the right atrium is a poor blood, is oxygen poor blood. So it needs to go to the lung first to pick up the oxygen. And also, this is uh, the partition that separates the chamber. This is the interatrial septum, the separate of the atrial, and also this is the interventricular septum. It will separate the ventricle. Alright, okay. The blood, just now, it will flow to the lungs through the pulmonary artery. Because this happens because the blood return from the body is relatively poor in oxygen, and it needs to be full of oxygen before being returned to the body. So the right side of the heart pumps the blood to the lung first to pick up the oxygen before going to the left side of the heart where it is returned to the body full of oxygen. So at this side, we're going to talk about the left atrium and also the left ventricle. Okay, the blood will return through the pulmonary vein, through this pulmonary vein, the rich blood, the oxygen rich blood will return to the left atrium, uh, and it will pump it to the left ventricle down here through the mitral wave, or we call it as acoustic wave. Yeah, this function is also the same, which is to allow the blood to flow in one direction. So when the blood enters the left ventricle, which is the strongest chamber of the heart, it will pump the oxygen-rich blood to the rest of the body through the aortic valve and go to the aorta before it will go to the rest of the body. So look here at the red mark that I put here. It shows that the it shows that the muscle of the left ventricle is thicker than any other heart chamber because it must pump blood to the rest of the body against much higher pressure in the general circulation. Okay, so it will pump through the aortic valve and to the aorta. Okay, the aorta is the main artery of the body. It will receive all the blood that the heart has pumped out and distribute it to the rest of the body. Okay. And also take note that all the arteries always take blood away from the heart, while for veins it will always take the blood back to the heart. For example, the superior vena cava and also inferior vena cava at the right side of the heart. Alright, so this diagram basically shows our body, our whole body of blood flow in our body. So basically, when our left ventricle pumps out the blood through the aorta, it will goes to the upper body and also the lower body. And we can see that the red color here, it shows that the blood is oxygen rich blood, while the blue one is shows that the blood is oxygen poor blood. Okay, so here the process of absorption happen where the cell will absorb the oxygen that it is needed, and also it will release the carbon dioxide that which is the waste products back to the heart to pump it at the lungs, and it will the same process happen again, and this happen all way all day. Okay. Okay, so this diagram shows us a few difference between the arteries, veins, and also capillary. So the first of all, the arteries, its function is to carry oxygenated blood away from the heart except for the pulmonary artery, because the pulmonary artery is is a artery that brings the blood to the lungs and return back to the heart. And the lumen for the artery is small and narrow. The wall is thick, and the other features is presence of muscular walls, largest artery which is aorta. And the second one is a vein. The function is to carry the deoxygenated blood from the body parts to cells except for the pulmonary vein. And the pulmonary vein is a vein that carries the blood from the lungs to the heart. So the lumen of the vein is large and the wall is thin. The other factors and the presence of wave to avoid the blood flow of blood. And the last one for the capillary, the function is it take care of the diffusion of gases and nutrients from the blood to cells of the body. And the lumen is very small and the wall is very thin to make the process become more easier. And the other features is semi-permeable walls for the transportation of gases and nutrients. Okay, so for the last thing that I'm going to present on this system is the technology associated with the system, which is cardiovascular system. So I'm going to talk about a pacemaker. Okay, this is it shows us a pacemaker that is implanted in our body. So let's get to know about pacemaker. Okay, it is a small device that is implanted into a patient's chest or abdomen. It uses a low energy electrical pulse to mimic the heart's own electrical signaling to beat at a normal rate and rhythm. So the pacemaker, it also coordinates the electrical signaling to the heart between the upper and lower chambers of the heart. They can coordinate electrical signaling between the ventricles to prevent heart failure. Pacemakers can also prevent the dangerous arrhythmias from occurring in patients who suffer from long QT syndrome, which is characterized by shouty and rapid heartbeats. And it also ensures that the right and left ventricles contract normally if patient suffers from atrial fibrillation, which is an irregular heart rate that affects proper blood flow. The pacemakers can speed up a slow heart rhythm, and a patient who suffers from irregular heartbeat or arrhythmia may need a pacemaker to keep his heart rate steady and regular. And the newest technology, which in this pacemaker, also have the technology to monitor and record the heart's electrical activity and heart rhythm so that doctors can obtain all of this information from a patient over time. So it will be more convenient both to the doctors and to the patient to know about their condition. So this is the technology that we have today, which is associated with the cardiovascular system. Okay, so that's all for today. Thank you for listening. Assalamualaikum warahmatullahi wabarakatuh.